Oh my god. This can't be Christian Benninger. It can't be Wellness 101, baby. And we can't be back at it again. But we are. This time with Mikaela Hazurjan, future board certified cardiothoracic surgeon.
Yes.
Literally not at all what she's going for, but it sounds cool. See, Mikaela and I, we're in nursing school right now, putting in that work, putting in those catheters.
Yeah, or not. On my end.
I have not touched a patient in 3 semesters of clinical experience, but it's okay. I'm going to be a great nurse, right?
Yeah,
that's what
we're
they
gonna
tell
be great
us.
nurses.
I got a job. I did get a job at Old Navy.
Oh, yes.
A little life update. I have a month left at Old Navy. I'm good. Hard pass. As we can see, the genetics are coming in. I have gray hair formation.
Oh, no.
Secondary to chronic stress / my father. So thanks, Dad. You've raised me right, but you've also given me gray hairs at the age of 20 years old. We'll talk about it later, sir. Mikaela, what's been going on? What's been happening?
Nothing much. Let's see. We've been together doing school.
Mm-hmm.
Couldn't do it without him and all of our little besties.
Mm-hmm.
I've been talking to a few new guys.
Oh! Yeah, I'm still single. This is about you, though.
Yeah, I'm just really excited for Christmas coming up, honestly.
And let's acknowledge
Seeing
her
my
hair.
family.
Her hair today is absolutely gorgeous.
Thank you.
Okay, so thank you for that summary, but I actually have an announcement to make.
Okay.
So today, Mikaela, so her dad owns a few restaurants, and we're going to one of them tonight.
Yes.
Okay, I'm gonna need Mikaela, can you shut your eyes?
Okay.
So basically, it's not really an announcement, but I want to wear this tonight.
Oh, God.
And I don't know if it's too much, but this is Christian Bittinger. This is Wellness 101, baby. And we're back at it again.
Is it a hat?
It might be, but don't open your eyes till it's on my head.
Okay. Oh, so it's okay.
It might be a necklace. Okay, it's that.
Yeah.
Yep.
All right.
So I bought this boy at TJ Maxx. Okay, wait.
I'm excited.
Wait, I don't know how to wear it. Wait,
Okay.
don't open your eyes.
I don't know.
Okay, you can open your eyes.
Let me see. I want to try to. Okay, so oh my God! Wait a minute. It feels like a cowboy hat.
Just do I look like I would wear a cowboy hat? Okay, you can open your eyes.
At least it's not a bucket hat. What? Oh my God!
Okay, listen, it was just an idea, and I
No,
got
it goes with the vibe of this shirt.
I don't know what kind of shirt to wear with it.
No, this is the kind of shirt you wear with this.
Is this
Tommy Bahama?
I don't know what that means.
I think that's this little.
Yeah. So should I wear it?
Yeah.
Okay.
Yeah.
Okay.
Yeah.
Okay.
Yeah.
Okay.
Yeah. I just. Okay. Okay. And do your snap. Yeah.
Listen, my friends. Okay, so I am going to naturopathic medical school after nursing school. The main reason why is because I think that I have a disorder. Okay, the disorder that I have is interconnected with 3 things. I can't whistle, blink with my left eye, or snap. No, I'm genuinely trying here.
He flicks.
But I digress. It's completely unrelated to the topic on hand.
Right.
Talk to me about communication.
Okay, yeah. So communication, guys. So important. Everyone always says that. They're in relationships, in friendships, in work, anything. Communication is number 1. You need to have that. And I never understood that really until I got in a relationship. And then I had my core group of friends that I actually loved and just vibed with. And I just feel there's always this negative connotation with communication equals confrontation. And that is not true. And that is not true.
What a beautiful...
It is not true. And also, people think confrontation is going to be negative. And it's not. Confrontation does not have to be negative. And the reason why I say that is because you can control how your conversation goes typically. You can control the tone, control the attitude you go into it with. So if you go into it with a really bad attitude and just with using a lot of you statements and making people feel attacked, yes, it's not going to go well. It's going to blow up in your face. It will.
I think it's important to know how you want the conversation to go before you have it. Because if you kind of go into any sort of situation, communication or not, with just going into it without taking a second first, okay, what's the purpose of me sitting down and have these conversations? Because typically if we're talking about communication in this way, the conversation is most likely crucial, aka it can go one of two ways, good or bad. And obviously if you want to have a crucial conversation, it's going to be with someone you either care about or you care about their opinion, whether this is a professional or personal relationship, right? We're talking with people, so we want to make sure that our points come across as respectful, but we also want to be respected. Evaluate things that you're still triggered about. So if you're going into a conversation, and whether it's a sensitive topic and you still have strong emotions, maybe hold off for 24 hours until we can come to a balanced state.
That's another important thing.
I kind of feel like I'm rapping right now. Like the words of wisdom are flowing out of me. We often think that our world is the world, and that's okay. However, it's not. AKA, we all have different perspectives of this life. Right? So by communicating what you're feeling and what you're thinking, that basically eliminates most possibilities of the person taking it the wrong way.
Exactly. Thank you.
Resting bitch face. Have we heard of it? The thing is you can have resting bitch communication non-verbally. Okay, so communication breaks up into verbal and non-verbal. They say that 80% of communication is non-verbal. AKA, what you say is the verbal part, what you're not saying, your mannerisms, how you carry yourself. How are your shoulders positioned? Are you making eye contact? Are you not making eye contact? Are you smiling? Are you frowning? Are you crying? Are you angry? Are you speaking fast? Are you speaking slow? Are you speaking high? Are you speaking low? You know what I'm kind of saying?
You're rapping.
Yeah, I am rapping. I got my brain down. Is how we communicate, and less so what we're saying, is a huge determinant.
Yes.
Right? So you're in an interview. You're in a conversation with your mom. You're in a conversation with your dad. You're in a conversation with your bro. I don't know who you're talking to here. But how you carry yourself is literally everything.
Yeah, you can.
Everything. Anyways, people are always observing you, whether you kind of are cognizant of that or not. People do notice. People notice excellence. People notice laziness.
When someone is like trying to share something with you, whether it be like kind of like you were saying, crucial or like emotional or whatever it is, please don't invalidate people's feelings. That is like the number one thing. Like, don't do it. Don't ever invalidate someone's feelings. I know like one of our friends, Zeta, she always says, look at something from your perspective and also take a second, put yourself in that person's shoes and see their perspective.
Ooh,
because that can often like really change the way you see a situation. I know she always reminds me of that, and I'm like, okay, you're right. Like, I need to see it from their perspective, because a lot of times you get so caught up in like what you believe is going on and what you think happened, and you don't even take a second to see where that person's coming from. So always do that. And this is my one thing I want people to take away from this video.
Are we getting emotional?
No, we're not getting emotional.
Okay, not yet. That's
but just
my job.
This one thing. I learned this at actually a clinical rotation of mine during mental health, your personal phase.
I love mental health. Keep going.
One of the therapists said, when you bury something, you bury it alive. And what she means by that is when you bury something that you're feeling because you don't want to confront someone, you don't want to communicate how you feel, that gets buried alive. It is not going to go away, and that will eat at you until it finally comes out after like multiple other things have happened with that person, and it just makes you like resent them. It makes you get angry at them, unless we would have just gone back, addressed it when it was happening, fixed it, and moved on. But no, when you do bury things, like, they're going to come out, and they're going to come out usually a lot worse than it would have been if you would have just nipped it in the butt in the beginning.
As nursing students, we are taught to look for signs and symptoms of things. Today, Mikaela and I are going to discuss signs and symptoms that you need to get your shit together. No, we're just kidding. We're just kidding. But signs and symptoms where you might have be holding things in. Yeah. We're talking you get annoyed with everything they do.
Everything.
They're folding the blankets. Oh my God, I hate the way she folds them damn blankets. You don't care about the damn blankets, Joseph. You don't. You don't, sir.
You're annoyed.
You might have had something where you and Nancy, that's always my go-to female name. I might need to see a psychologist about that, because I still don't understand why I revert to that. You might be holding things in with something serious that happened between you two. And so you thought, okay, well, I care about this person, so I'm just going to repress it. Or I don't feel comfortable, whether you're in a professional setting. I don't feel comfortable talking of this because I don't want it to spread around. I don't want the relationship to be tarnished. However, if you're constantly becoming agitated with this person, no matter what they're doing, you don't want to be around the person. The thought of hanging out with them makes you want to like punch a wall, or you just feel uncomfortable around them. You don't feel as if you can open up to them. You feel closed off. Things like that, where you just in general feel yourself drawing yourself away. That feeling of resentment that you're holding on to, let's say someone did you wrong, that's hurting you.
I'm mad.
Okay, let's say Mikaela's mad. Excellent example. Very intellectual. She's mad. Oh, okay.
Yeah.
Why are you mad at me? What did I do to you that really upset you? Hypothetically, because I'm a good friend, right?
Right.
We're like,
you cheated on me.
okay, we're
No? Okay.
okay. Mikaela and Christian are in a relationship. Just kidding. She's out of my league. So Mikaela and I are in a relationship, and I cheat on her. Okay.
Don't do it.
I would never, but hypothetically, I cheat on Mikaela. Okay. We break up, and she is just so infuriated with me. I am a heartless piece of crap. I move on with my life, whatever, right? I don't care. I'm dating again. I'm messing around. I'm doing whatever I want to do. Okay. She thinks that hating me is going to make her feel better. It might feel better, superficially, right? She sees me, she's acting like she hates me, right? Who is that hurting? Mikaela. It's hurting Mikaela. Yeah. Any resentments that you have towards someone, whether you have had them or you still have them now, if you're still holding on to that conflict, that's affecting you. And that all ties into the importance of communication, because we're talking about when things happen to you. If you're not ready to discuss it with the person that affected you, that's not what we're asking. We're simply suggesting that talking about what we go through is a way to deal. It's a way to cope. It's a way to grow. And when you don't talk about things that are hurting you, when you sit there and you hold it in, it's so destructive to your mental health.
Yeah, very.
It's so destructive. And by the way, this is your life.
And, like, this doesn't, like, happen overnight either. It takes time. And, like, yes, you are going to feel very angry. When someone wrongs you or, you know, whatever the situation may be, you are going to be angry. And that's okay to feel. 100%. You can be angry. But at some point, you have to let the things go that people do to you. Otherwise, they just affect you more than anything. They eat away at you. They're not affecting that person. Christian might have cheated on me and he doesn't care. He's moved on. But yet I'm still dwelling on that. And it can just end up hurting you in the long run more than it's hurting that person. And so just, like, getting that out, and it might not, like you said, it might not be talking to that person that hurt you, but just getting it out to anyone.
2 months left. You know what that means? You have 2 months left of 2020, baby. You have 2 months. Why not? No. We're not waiting until the new year, new me. Hell no. Okay? This is your freaking life. Let's start living. And a part of that is communicating what you are going through. I'm so sick of the idea that communication equals weakness and admitting areas that you are hurt equals weakness. Absolutely not. No one's gonna know what you're thinking if you don't say something about it.
People are not mind readers.
No.
And especially my ladies out there. We all think that men are mind readers. They're not.
Oh my God. No, we suck. We suck.
Like they can't even understand when you communicate with them what you're feeling. Okay. They're still confused.
All right, that hurt a little bit. No. Straight up, I think women are brilliant. They're beautiful. So confusing. Oh my gosh.
Yeah.
Oh my gosh.
And we just think like, oh, you can read our minds.
Oh no, we can't.
But like, they can't.
No.
And they're not going to know unless you say something. Please.
Oh, let's real quick give a little bit of perspective. You're going to give the female perspective for obvious reasons. I'm going to give the male perspective. Listen, it's not that we don't want to communicate our feelings. We are just scared. I'm not really scared anymore because emotional intelligence. I'm just kidding. But we are scared of being seen as weak, inferior. We're being seen as not manly because that's what women want. They want a man. Again, these are things that we're taught, so I'm not saying they're all true. These are beliefs that have been instilled in us. These are values. You know, be a man. Don't talk about things. Stop being a whatever. Insert harmful words. You know what I'm trying to say. So it's hard for us to communicate what we're feeling because we're taught it's a weakness. What is the female response to that?
Okay, that... Like,
and try not to be, like, upset because, like, think about, like, when you're in school and, like, you're growing up and, like, you try and show any emotions because when you're a kid, you don't care about what people think. And then we get to middle school, high school, and when men try to communicate, when, you know, boys and teenagers try to communicate, it's seen as feminine.
Oh, Christian. I personally, I don't know how that ever came to be because if you look at the one thing that women always want, they want you to be honest with you. And they want you
Yeah, that's true.
to share your feelings with them. Like, that's all we want. We just want to know what you're thinking, because guys, sometimes I don't know what they're thinking. I don't know what's going on up there.
It's both of us.
Yeah.
Neither of us know.
Right. And so, like, I don't understand where that came from, because we simply just want you to share your feelings with us. So that is never seen as weakness, ever. I have never thought about it as weakness. I've never thought about it as being feminine. Just like, that's just communicating. Like, things get lost so much in translation. So if we can just simply share how we're feeling, that will stop. People will stop misunderstanding things. People will stop getting angry over stuff that was not meant to be taken a certain way. Like, it is just so simple. Okay. So just to, like, summarize it all up, people think that communicating equals weakness, at least sometimes on a guy's end. But if we take a second and realize how hard it is for you to open your mouth, how hard it is for you to simply just share how you're feeling, that is not weakness. That is strength. And that is just, like, being comfortable with who you are and being able to express that to someone and have them validate your feelings. That is not weakness. That shows strength.
I feel so much, like, relief because, no, seriously, it's like, as a man, I just want to, like, treat my lady right. You know what I'm saying? In my relationships, friendships with men or women, I want to treat people right, and I, like, want to show my, my heart. And I do now, because I'm at a place now where, like, I know that the people that are in my life are supposed to be, and that I'm loved, and that who I am is beautiful. Who we all are is beautiful. And I'm daily discovering who I am, and I'm just embracing all sides of it. I'm trying to stay balanced with it. Occasionally I go to one extreme or the other. And that's just, part of life. That's how we find our identity. But I say all that because I found that when I'm, like, vulnerable and I, like, talk about things,
You feel so much better, right?
I feel so much better, but also I'm connecting with, like, with men and women more than I ever have.
Yes.
And I'm saying, like, that's, like, in the school setting. I find myself being a leader in the classroom now because I'm just speaking out. I'm speaking what I'm feeling.
Exactly. And
what
people
I'm
respect
thinking.
that.
People respect it. It's hard because sometimes we encounter people, and this is another part of emotional intelligence. We meet people where we try and share our feelings, and they don't care, or they don't know how to respond. And I think a part of this whole communicating thing is assessing who and where to have these conversations with.
Definitely.
Because there's definitely is a time and a place. If something's bothering you, it's important to, make sure that your environment is controlled with minimal distractions, and that the person that you want to talk to is at a place where they can receive any of this. So I think that it makes sense why people struggle. It totally makes sense, because through our life's experiences, we may not have grown up in a welcoming setting where you can just talk about your feelings. Most adults that have, like, a lot of professors that I've had where we talk about mental health, it's like they say that they were not raised to talk about these things. Our generation's kind of different because people like us are saying, oh, no, this is bothering me and I need to talk about it with someone.
Yeah.
And that might be seen as being loud, being eccentric, being, I don't know, weak. I don't care. If something's bothering me, I need to say it. I'm not going to hold it in and then one day outlash on someone. That's why you see abuse.
Yeah.
That's why you see suicide episodes, right? Those triggering factors where people commit violent crimes towards themselves or others, right? That's research has shown that's often attributed with years and years of suppression, years and years of just holding things down.
Yeah.
And we're not saying that that's going to happen if you hold things down. We're simply saying that why waste another freaking day being miserable?
Yeah, exactly. Couldn't have said it better myself.
Like, this is Wellness 101, baby. We're communicating vulnerable topics right now because we're all trying to get to a place where we realize that communication is so important.
It is. And I didn't realize that, like, when I was younger, I was that person that would avoid everything.
Yeah.
I would avoid it because I was scared.
Yeah.
I didn't know how to communicate my feelings properly. I was just, like, always just, like I said, scared of them not receiving what I was saying very, like, well, because they would get mad or they would get angry. But a lot of times you find those people that are going to get angry with you are not validating your feelings, and those people, maybe just
love them from a distance.
Yeah.
Or don't have those crucial conversations with them. Again, superficial relationships, awesome. Friendships with your coworkers, awesome. Other classmates, great. But there's a time and a place to have conversations, and when you find those people where you can have those, whether that's friendships or professional, maybe getting a therapist or something like that, just talking. Oh my gosh, if there's one thing on Wellness 101, baby, that I want to emphasize, going to see a therapist is about one of the best things that you can do, especially if you don't have someone that you can talk to on a regular basis about things that are important to you.
Because they are just, whatever you're talking to them about, they're not part of the situation. They are they have no judgments, they have no prior biases, and they can just give you an open perspective on the situation.
And their priority is your overall mental health and well-being.
Yeah.
This, like, okay, yep, one more time. This is Wellness 101. We care about your mental health. We're not here to just spew random things at you. I genuinely care about people so much. I can't wait to be a doctor where I do this all the time. But, like, Mikaela and I, like, we're nursing students. That doesn't matter. We're just here to talk about things that we all go through because you're not alone in whatever you're going through.
Yes.
I say that every time. I'm going to continue to say it because it sucks when you're going through something and you think that you're alone, but you're not.
Yeah.
Whether she's going through something that I might not be going through, that's less relevant. More relevant is her knowing that I'm here for her no matter what. Yep. Right? You don't need people to go through exactly what you're going through. You don't need to be sick to help sick people.
Exactly.
You don't have to be poor to help poor people. Like, you know what I'm saying? You don't have to be in someone's exact situation to help them. And this vlog is to uplift, empower, and inspire. It's to ensure that you know that you can freaking do this, but you don't have to do it alone. This is your life. You need to take some responsibility and then ask for help. No one's going to get you off the couch, and no one's going to get you to call that therapist, to call your friend, whoever it is. If something's bothering you, you need to communicate it. That was funny.
You need to communicate.
Okay.
Mic, baby.
Yeah. I mean, I thought that was pretty glorious.
I thought it was too. Nothing easy. What does it say?
Nothing easy. Okay, see you next time.
What is the saying though?
Nothing easy comes hard. I'm just kidding. Nothing hard comes easy. No. I don't even know what you were trying to say, but I really want to know.
Well, see, we're all human. I'm trying to communicate.
Yeah.
What the
And as you can see, she sucks. No, I'm just kidding. Mikaela Hazurjan, board certified cardiothoracic surgeon. I just want to thank you for setting time aside from your
You're
day
welcome.
to
Yes,
just
I have
come
to get
talk
back to
with
my
us.
surgery now.
You're right. She
My
has
triple bypass.
Yep. Okay. I'll be in a scrub in. All right. So, guys, thank you for watching.
Yes.
You know that I love you. Ooh! Or else, why would I be sitting in my room on a Sunday afternoon talking to my iPad? I am a nerd. I digress. Guys, thank you for listening. Oh, I cannot wait for next time. Mikaela's going to be back at it again as well as I am. So we'll talk to you guys soon.
Yes, have a great rest of your day or week or whatever it is.
Mm-hmm.